Well, when you go to the doctor's office or have a procedure done, it's easy to forget that their directions, what to do next, or perhaps you're confused by them. I likely am. Directions also printed in prescriptions can lead to extra questions.
Yeah, it can be quite confusing, but new research shows that 1/3 of middle-aged Americans misunderstand medical directions and tasks. That's a big number. So we've gone ahead and brought in our 9 News medical expert, Dr. Payal Kohli, to talk more about this. Dr. Kohli, we mentioned that 1/3 number. That's a sizable number, but it's not just middle-aged folks dealing with this problem.
It's a huge number, and it's bigger than we even expect in the healthcare system. And you mentioned middle-aged patients, but if you think about older patients who have cognitive problems, who have memory issues, who have dementia, that number can be even higher. And even as a doctor, I am very shocked to learn that only 12% of Americans are what we call health literate in a proficient level. Wow. And so that means essentially 1 out of 10 of my patients are able to make the medical decisions, able to remember what I tell them, and able to really think critically about their disease and ask the right questions. So that means we have to try harder in the medical system, but it also means that you guys as patients need to be better informed about what to ask your doctor.
Right. I do think that a lot of it does fall on us. I think that we just kind of follow suit, and you got to be your own advocate as well. It's a team. Talk to us about what are like the specific mistakes that you guys have noticed when it comes to patients.
So for example, Sam, if I said take this medication 1 tablet twice a day, commonly people will take 2 tablets at the same time. So that's really common. That twice a day thing becomes, oh, let me take 2 at the same time. Patients often don't ask about food interaction. Should you take with or without food? So that's something that gets confused. They don't ask about side effects. And if the doctor doesn't have the time or is rushing through the visit, doesn't always go through the side effects, they don't actually link the side effects to what they're supposed to do. And if you look at the data, it's quite interesting. The majority of patients, when they leave the doctor's office, within a few minutes of leaving the doctor's office, can't repeat back to you what the doctor said, what their diagnosis was, or what their next steps are.
Wow.
Alarming.
Yeah, and that's certainly a concerning trend here. When we talk about these misunderstandings, does this really all boil down to communication?
It does for the most part, but it also boils down to your underlying level of literacy. So we know that a lot of patients in our office, again, as we get older, our brain doesn't work quite as sharp. We in the medical system use a ton of jargon, right? And I'm responsible for this because I communicate with my staff in this way. So sometimes we use medical jargon that patients don't understand. If you've ever looked at a prescription bottle, it's got all kinds of numbers, all kinds of fancy drug names, and sometimes they come in boxes. Sometimes they come in pill packs. So the way that we package and label is also part of the problem as well in terms of getting patients to understand. And often when they leave the visit, we have to ensure that they have understanding. So what I tell my patients, and I want you guys to practice this with me right now, it's called the teach back method. So, and this, they taught us this in medical school, but we're not good as doctors at doing this. So patients have to ask for it. So let me get this straight, Dr. Kohli. You want me to take 1 medicine, 1 tablet, twice a day, and it doesn't matter if I take it with food, and what side effects should I watch out for? So that's called teach back, where they repeat it back to me. So now I want you to teach me back what I just taught you.
Do you remember it?
Yes.
Okay, I forgot already. 1 tablet twice a day.
And whether or not I should take it with food?
And side effects. So see, just now, and you guys are both, young and bright, and so you can imagine if I'm rushing through the visit, and I'm not just changing 1 medicine, but 2 or 3, and I've just blurted it all out, and someone doesn't write it down. Some of my patients take my permission and record the visit so that they can then go home and listen back to it. So that's another way. If teach back doesn't work for you, then you could ask permission to record the visit.
Or take notes, right?
Or take
during the visit.
And that's a great idea. Something I've been doing lately, and I don't know if this is what you would advise, and if you don't, please tell me, is I do forget what they tell me. I'm one of the percentage. I've been asking the pharmacist to go over it with me. Is that okay?
That is a great idea.
I love my pharmacist, Brandon. Shout out.
Yeah,
especially because the pharmacist has a global sense. So I'm your cardiologist. I'm working on my cardiology island. Your endocrinologist is on their island. Your kidney doctor's on their island. So the pharmacist is really where the final common pathway comes. And often, and this is the other thing that we're not good about in the medical system, drugs have interactions with each other. And I don't know that your primary care doctor started an antibiotic. And so I might write something that interacts with something else. So always using the pharmacist as a way to teach is also a great tool. I love that.
Yeah, great advice.
Yeah. All right, so next time you guys go to the doctor, I want you to teach back, to them.
Yes.
Not talk back, teach back.
Don't talk back.
Don't talk back to the doctor. That is never recommended.
Thank you.